We know that many older adults want to remain independent and live in the community for as long as possible. We know that as needs and abilities change, people may need extra help to do this. There are services available to help eligible individuals, such as home care and support services to seniors. Others may choose to move to a more supportive living environment. Caregivers often struggle with the question of if and when alternate living arrangements should be considered. There is no right or wrong answer to that. It will depend on your individual situation. There are a range of community housing and support options available, and it is important to know what these are and consider them early. Supportive housing is a community housing option designed for people who can no longer live in the community independently with the available resources, but are not yet ready for a personal care home. Supportive housing consists of individual apartments in a group community setting. Services are provided such as meals, laundry, and housekeeping, and people will have their meals together in a shared common dining room. Social and recreational opportunities are provided and will vary per site. On-site 24-hour support and supervision is available 7 days a week. Supportive housing provides a secure environment. This means that security mechanisms are in place to protect people at risk for wandering. Access to supportive housing is through the Regional Health Authority, and there is specific eligibility criteria. An assessment by home care is conducted if a person is living in the community, or by a hospital team if the person is coming from hospital. If you think supportive housing might be the appropriate option for you, I would suggest that you talk to your home care case coordinator about it. If you do not have a home care case coordinator, you can call Central Intake for an assessment at 788-8330. Costs will vary per site. People pay the landlord for the rent and the service package. Costs will vary, and there are some low-income, affordable housing available. Talk to your case coordinator if you want to know what rent supplements are available for people on low income.
Assisted living is individual apartments with a service package. It's in a community setting and often has a congregate meal program in a dining room, socialization and recreation included, as well as housekeeping, and may have 24-hour emergency response. No personal care is provided, and personal care needs to be provided either by home care or a private care company. Access is open to anyone is able to go to a different facility and put their name on the facility waiting list and to find out information regarding it. As far as costs, there are a variety of different costs depending on what type of service package you're looking for. They can range from a studio apartment at $1,000 up to a one-bedroom that may be $3,500. And often the services then do fluctuate as well. As far as locations, you're best to take a look at the Age and Opportunity Housing Guide to find out what assisted livings or retirement communities are available in your area for a complete listing, which also shows what some of the pricing and services are for you. Other factors to consider are your ability to live independently and also your mobility. It's important to make sure that when you're looking at an assisted living that you're trying to suit the location to what your needs are at the time.
Personal care home is a facility that is dedicated specifically to providing care for those individuals whose long-term care needs can no longer be met at home by family and/or supporting services. Usually this is a choice that's made after all alternate choices are explored. Your doctor or home care case coordinator can refer you to the appropriate place to assist you in applying to a PCH and initiate the paneling process. 3 components of PCH: accommodation. This includes lodging, meals, snacks, laundry, and housekeeping. However, the provision of personal clothing, toiletries, any personal items, and special off-site transportation remains the responsibility of the resident. Recreational programs are offered, as are on-site professional nursing services 24 hours a day, 7 days a week. On-site personal care by healthcare aides to help with bathing, dressing, toileting, and feeding is available, and intermittent health professional services such as physiotherapy and occupational therapy may be available as well. And there will always be an attending physician provided for you. Transitions to long-term care are never easy. Please don't consider this a handoff. You continue to have an important role as a caregiver. Please remember that you are one of the most important people on the care team. You know your loved one best. Focus on the right environment that provides the right support and care at the right time.